Do you know what an epidemic is? A health epidemic is any serious disease or condition that spreads rapidly across the population, causing sickness and death. Right now in the United States, we have a health epidemic that's overtaking us. Typically, when we have any sort of threat, like in 2009 when there was a threat of swine flu, there's usually a rapid mobilization of resources. Information gets out to the public quickly, and then I walk around, I hear people talking about, and especially in 2009, how they were going to prevent getting the flu. They had ideas. People were talking about ideas, what supplements they were going to take, how they're going to prevent it. People really got on board. Right now, 1 in 3 people are infected with this health condition I'm going to talk about. And yet I'm not hearing a lot of people talking about how serious it is, not just for each person individually, but for the economic well-being of our country. I'm referring to the obesity epidemic, which is overtaking us. Over 100 million people in the United States are obese. That's 1 in 3 people right now. First, I want to show you how the epidemic has grown. Up on the screen, I have a map of the United States in 1990. The light blue states are states that have obesity levels less than 10%, while the medium blue are from 10 to 14% obese. The white states there's no data for. I'm going to rapidly move us through 20 years of slides, and you can see how it's increased right under our nose. Back in 1990, we were 1 in 10 obese in the United States. In 1991, we see a new color, the darker blue. 14 to 19% of people in these states are obese. 1993, 1994, 1995, 1996. 1997, we see the introduction of states that have popped over 20% obese. 1998, 1999, 2000. 2001, we see Mississippi hits 25% obese. That's 1 in 4 people. 2002, 2003, 2004, 2005, we see 3 states hit over 30% obese, 1 in 3 in those states. 2006, 2007, 2008, that's Colorado in blue that's holding out, 2009, and 2010, last year I have data for, we see no state is below 20% obese in 2010. Overall, right now we have 1 in 3, 33% of Americans are obese. So it's pretty serious, the increase. They say it's going to keep going. We're not going to even plateau till we hit 42% obese. That's almost every other person. I think part of the problem is this is what I thought obese was. You know, this is the picture I had in mind when somebody says obese. It's something like this and maybe bigger. Actually, obesity is defined as having a BMI of greater than 30. And BMI is a body mass index. It's just a ratio of your weight to your height. And at 30, they've decided, you know, that's what's called obese. And I think obese is colloquial, I guess, the word. But the truth is it's actually a word that describes kind of this ratio. And what that looks like is this. These are people that are at BMI 30. And it's not what I thought obese. These people, you know, some of them look regular weight to me. Some of them are a little bit overweight. But nobody conjures up the image of obese. But at this rate, this is when the serious health conditions start happening. Over 30 serious conditions are on the rise because of the rising obesity levels. We're looking at increases in heart disease, in cancer, in diabetes, all of them in the major top 6 ways that people can die. I was kind of surprised to learn that cancer, the #1 cause for preventable cancer used to be smoking. Pretty soon it's going to be obesity. It's going to overtake. I didn't even think cancer and obesity were related. It's going to be the downfall of our country because economically, what we see with obesity is we see that the condition happens, you get obese, and maybe 10, 15 years later, you really start seeing the health conditions really costing a lot. Right now already, we're spending between 10 to 30% of our healthcare dollars on obesity. That's $150 billion to $300 billion each year just on obesity-related conditions. And for every dollar we spend on obesity, it costs us another dollar in lost wages, missed time at work, disability. So this is the serious problem. This is a health crisis, but this is an economic crisis for our country. It's going to cost us way too much to be able to deal with. And as I was saying, researchers say that we're not going to slow down till we hit 42%. Then we're going to plateau, and then 15 years after that, we're really going to start paying for this. Again, this is a spectrum of people with BMI. In red, we see the people that have obesity, are obese, BMIs of 30, and researchers say that ideally we want to be in the low normal range. That's the people circled in blue, because cancer risk doesn't go down until we're actually low normal. My intention today is to increase awareness of the serious crisis that's facing our country so that we can mobilize and start talking about what we're really going to do about this problem, which is going to affect all of us and possibly bankrupt our country. Mr. Toastmaster.
Wow.